First tonight, the rapid increase in COVID-19 cases in Central Texas, leading more people to be hospitalized. Thanks for joining us for the News at 5. I'm Brian May.
And I'm Ashley Goodo. KVUE's Connor Board joins us live from the newsroom with more on the number of people being admitted. Connor?
Ashley, Brian, over the past week, Austin public health leaders say 375 people were admitted into hospitals with COVID-19. That's double the number we saw the week before. With how contagious the Omicron variant has shown to be, local hospital workers are ready for a long January.
A new year with the same virus, but this time an even more contagious variant.
They've certainly ticked up here recently within the last week or so. And so we're seeing higher numbers. For the most part, they're probably not as ill as we have seen in previous waves of patients.
Just a week ago, area hospitals collectively were seeing an average of 28 people being admitted to the hospital per day with COVID-19. Yesterday, that number was 66. And Dr. Matthew Robinson, the medical director of infectious diseases at St. David's South Austin, says they expect this trend to stay for at least a little while.
I don't know where the crest will be, but I expect to see numbers at least as high as we're seeing now for the next few weeks in all likelihood.
Over the past 2 weeks, of the people hospitalized with COVID-19 in the Austin area, 47% were unvaccinated, 39% were fully vaccinated, 5% were partially vaccinated, and 8% were boosted. Both Austin public health leaders and Dr. Robinson say to note that many of the vaccinated people included in these counts are not actually hospitalized for COVID, but are testing positive during routine screening.
We're also seeing patients that are coming to the hospital for different reasons and sort of incidentally have a positive test.
Doctors say boosters have shown to be effective. Over the past 2 weeks, 13 fully vaccinated people with no boosters were in the ICU, while only 2 people who were boosted were in the ICU. Although this increase is putting stress on hospital staff at all 3 major area hospitals, they say they will continue to serve our community just as they have the past 2 years.
We're going to get through this, and we'll continue to be here when they need us.
And we have also seen an increase in pediatric COVID-19 hospitalizations. Today, Dr. Desmar Walkes with Austin Public Health said over the past 2 weeks, there were 42 kids hospitalized with COVID-19 in the Austin area. The 2 weeks before that, there were only 11. So we are seeing numbers increase across the board when it comes to hospitalizations. And although doctors agree Omicron is less severe overall, that is not the case for everyone. Brian?